As men age, especially once they pass the milestone of 60 years, prostate health naturally becomes one of the most important topics to understand and manage, yet remains surrounded by myths, misconceptions, and a surprising amount of silence, even among close friends and family, because the prostate gland, a small but vital organ roughly the size of a walnut, plays a crucial role in the male reproductive system by producing seminal fluid that nourishes and transports sperm, and its health significantly impacts urinary function, sexual performance, and overall well-being. And while many men may notice changes like more frequent urination, weaker streams, or discomfort in the pelvic area, they often don't realize how intricately linked these symptoms are to lifestyle factors, including masturbation frequency, a topic many avoid discussing openly, but one that urologists are increasingly highlighting due to its profound influence on prostate health. Because masturbation is not just a form of sexual pleasure or stress relief. It is also a natural physiological process that helps flush out the prostate, reduce fluid buildup, and maintain tissue health. And failing to engage in regular ejaculation through masturbation or sex can lead to stagnation of prostatic secretions, which may increase the risk of inflammation, infections, and even the development of benign prostatic hyperplasia or BPH, a condition characterized by prostate enlargement that affects millions of men over 60 worldwide. And in this video, we will uncover the shocking and lesser-known science connecting prostate health and masturbation, dispelling harmful myths that cause men to unnecessarily avoid release, and instead showing how regular, mindful ejaculation can be a powerful tool in maintaining prostate function and preventing disease. And it's important to start by understanding what happens inside the prostate during ejaculation, because with each release, prostatic fluid is expelled, helping to clear cellular debris, reduce oxidative stress, and maintain healthy blood flow within this gland. And research has shown that men who ejaculate more frequently tend to have a lower risk of prostate cancer, as well as fewer urinary symptoms, indicating that masturbation or sex is not only safe, but beneficial for the aging prostate and beyond the physical clearing effects. Masturbation also promotes hormonal balance, releasing endorphins and dopamine that reduce stress and inflammation, both of which are key contributors to prostate problems. And in fact, stress itself can exacerbate prostate issues by increasing muscle tension in the pelvic floor and altering immune responses. So the stress-relieving benefits of masturbation carry added significance for prostate health. And yet, despite these benefits, many men over 60 reduce or stop masturbating due to cultural stigmas, misunderstandings about aging sexuality, or health fears, which ironically may increase their risk of prostate discomfort or disease. And this is why it's so critical to challenge outdated beliefs and encourage open conversations about masturbation as a healthy, normal, and important part of men's health at any age. And as we proceed, we'll also explore common prostate problems like prostatitis, BPH, and prostate cancer, how masturbation interacts with these conditions, and the ways men can use ejaculation frequency as a preventative measure, while also recognizing when medical attention is necessary. And finally, we'll discuss practical tips on how to incorporate masturbation into your routine safely and enjoyably, emphasizing self-compassion and body awareness. Because taking control of your prostate health through understanding and action can transform your quality of life, boost your confidence, and empower you to age with vitality and dignity. And with this foundation in place, we are ready to dive deeper into the surprising science and real-life advice that will guide you toward healthier prostate function and a more fulfilling sexual life after 60. As we move further into understanding the intimate connection between prostate health and masturbation, it becomes clear that regular ejaculation plays a pivotal role in maintaining not just comfort, but longevity of the prostate gland, because the prostate is uniquely vulnerable to the effects of stagnation. When prostatic fluid is not regularly expelled, it can accumulate and create an environment conducive to inflammation, bacterial growth, and cellular damage, which over time increases the risk of prostatitis and benign prostatic hyperplasia, conditions that can severely impact quality of life for men over 60. And scientific studies have increasingly supported the protective effects of frequent ejaculation. One landmark research project published in the Journal of the American Medical Association tracked thousands of men over several decades and found that those who ejaculated 21 or more times per month in their 20s and 40s had a significantly reduced risk of prostate cancer, compared to those who ejaculated less often, suggesting that this natural process actively flushes out harmful substances and reduces cellular buildup that can lead to malignancy. And while this data often focuses on younger men, the principles apply equally as men age because the prostate does not cease its metabolic activity, and maintaining fluid flow remains essential to preventing blockage, irritation, and chronic discomfort. And for older men who may struggle with urinary symptoms like frequency, urgency, or weak stream, masturbation offers a non-invasive, self-directed way to promote prostate drainage and relieve pressure without relying solely on medication or invasive procedures. And this is especially important given that many drugs used to treat BPH and other prostate conditions come with side effects that can diminish libido, energy, or mood, thus creating a vicious cycle that masturbation can help to break by naturally balancing hormones and releasing pleasurable neurochemicals like dopamine and oxytocin, which improve mood and reduce stress. And speaking of stress, it's critical to highlight how emotional well-being intertwines with prostate health, as chronic stress triggers a cascade of hormonal changes that can exacerbate inflammation and pelvic floor muscle tension. And masturbation serves as a powerful stress outlet, providing both physical relief and emotional calm, which together create an optimal environment for prostate healing and maintenance. And it's worth emphasizing that the benefits of masturbation are not just physical or hormonal, but psychological as well, because men who maintain a healthy sexual routine report higher self-esteem, better sleep, and deeper intimacy with themselves and their partners. And all of these contribute to a more vibrant, fulfilling later life. And yet, despite these advantages, there remains a widespread reluctance among men over 60 to talk openly about masturbation, often due to outdated cultural taboos, feelings of guilt, or misconceptions that sexual activity is inappropriate or unnecessary after a certain age. But these beliefs are not only harmful, they're scientifically unfounded and rob men of a vital tool for maintaining health and happiness. And so it's vital to reframe masturbation as a form of self-care and a medical recommendation that urologists increasingly support. Not a secret or shameful act, but a routine health practice comparable to exercise or balanced nutrition. And for men experiencing prostate symptoms, masturbation can even be part of a therapeutic plan, often recommended alongside pelvic floor exercises, dietary changes, and stress reduction techniques. And if you're worried about overdoing it, rest assured that there is no universal right frequency, and the key is tuning into your body's signals, ensuring that masturbation remains a joyful, comfortable experience rather than a compulsive or stressful one. And in the next section, we will explore practical advice for safely integrating masturbation into your lifestyle, how to navigate potential challenges such as erectile dysfunction or physical discomfort, and tips for communicating about sexual health with your healthcare provider and partner. because the path to prostate wellness is not just biological, but deeply relational and holistic. And by embracing masturbation as a natural, healthful practice, men over 60 can reclaim control over their bodies, reduce symptoms, and enjoy a renewed sense of vitality and connection that enhances every area of their lives. As we continue to unravel the deep connections between prostate health and masturbation, it's essential to address some of the common concerns and obstacles men over 60 often face when considering integrating or maintaining regular masturbation as part of their wellness routine. Because despite the clear scientific benefits, many men encounter physical, psychological, and social barriers that can make this practice seem daunting or confusing, and one of the most frequent challenges is erectile dysfunction, a condition that becomes more prevalent with age due to a variety of factors including reduced testosterone levels, vascular changes, medication side effects, and underlying health conditions like diabetes or hypertension. And while erectile dysfunction can understandably dampen enthusiasm for sexual activity, it's important to recognize that masturbation can actually serve as a safe and private space to explore what feels pleasurable, to maintain pelvic muscle tone, and to promote blood flow to the genital area, which in turn can improve erectile function over time. And many urologists recommend pelvic floor exercises, also known as Kegels, for men to strengthen the muscles that support erections and urinary control. And combining these exercises with masturbation can enhance results by encouraging regular circulation and reducing prostate congestion. And in addition to physical hurdles, emotional and mental health factors also play a significant role, because feelings of embarrassment, shame, or guilt about masturbation, especially if these feelings are rooted in long-held cultural or religious beliefs, can create internal conflict that reduces the enjoyment and benefits of release. And overcoming these emotional blocks often requires compassionate self-reflection, education, and sometimes support from therapists or healthcare providers who specialize in sexual health, helping men to reframe masturbation not as a sinful or juvenile act, but as a natural health, promoting behavior that deserves respect and acceptance at every stage of life. And for men who are in relationships, communication about masturbation and prostate health is another crucial area, because some partners may misunderstand or feel threatened by masturbation, seeing it as a replacement for intimacy or an indication of dissatisfaction. But when framed positively, as a complementary part of overall sexual health and self-care, it can actually strengthen relationships by reducing pressure, enhancing individual satisfaction, and opening new avenues for dialogue and connection. And this kind of honest conversation fosters intimacy, trust, and mutual respect, which are foundational to lasting sexual and emotional fulfillment. And it's also worth mentioning that the physical environment and mindset matter greatly. So creating a private, comfortable, and relaxed space free from distractions helps men to focus on their own pleasure and body awareness. And incorporating mindfulness techniques such as deep breathing, progressive muscle relaxation, or gentle meditation can further enhance the experience by calming the nervous system and increasing sensitivity, allowing men to feel more connected to their bodies and the present moment. And as you embrace these practices, be patient and kind with yourself. Reconnecting with masturbation after years of avoidance or neglect is a process that unfolds in its own time, and celebrating small victories, whether it's increased comfort, reduced prostate discomfort, or simply a more positive attitude toward your sexual health, is an essential part of the journey. And lastly, nutrition and lifestyle choices also significantly impact prostate health and sexual function. So maintaining a diet rich in antioxidants, omega-3 fatty acids, and vitamins like D and E supports prostate tissue integrity and hormone production. While regular physical activity promotes circulation and hormonal balance, and avoiding smoking, limiting alcohol, managing stress, and getting adequate sleep round out a holistic approach that synergizes beautifully with regular ejaculation through masturbation. And by integrating all these elements, physical, emotional, relational, and lifestyle, you create a powerful foundation for prostate health that can enhance your vitality, comfort, and pleasure for years to come. In the final part of this video, we'll provide a detailed, step-by-step guide on how to safely and enjoyably incorporate masturbation into your routine, including techniques tailored for men over 60, tips for managing common challenges, advice on talking to your doctor, and encouragement to embrace this practice as a vital component of your overall well-being and happiness. So stay tuned and get ready to reclaim your prostate health and sexual vitality with confidence and ease. Now, as we reach the final and most empowering part of this discussion, it's time to focus on practical steps and gentle guidance that will help you confidently integrate regular masturbation into your life to protect and enhance prostate health, improve overall well-being, and restore a sense of vitality and pleasure that every man deserves to experience regardless of age. And the first step is to create a mindset of acceptance and curiosity toward your body's natural needs and rhythms, because approaching masturbation as a positive, healthful practice rather than something to feel embarrassed about or ashamed of is essential to breaking down the barriers that have held you back. And start by setting aside time in your schedule where you feel relaxed, unhurried, and private, creating an environment that feels safe and nurturing, perhaps with soft lighting, comfortable surroundings, and even calming music if that helps you unwind. Because the psychological environment is just as important as the physical when it comes to enjoying and benefiting fully from masturbation. And when you begin, focus on tuning into your sensations with a gentle, non-judgmental awareness. Notice how your body feels, where tension may be stored, and what types of touch bring comfort and pleasure, experimenting at your own pace without rushing or pushing yourself to perform. Because the goal is not speed or intensity, but connection and release. And for men who have experienced erectile difficulties, consider starting with gentle stimulation that doesn't require a full erection, using lubrication to reduce any discomfort, and integrating pelvic floor exercises to gradually strengthen the muscles involved in arousal and ejaculation. And if pain or discomfort arises, listen carefully and adjust your approach accordingly. And if it persists, consult a healthcare provider to rule out treatable conditions. And for those who have partners, try including masturbation as part of shared sexual intimacy, whether by communicating openly about your needs and experiences or exploring mutual masturbation as a way to deepen connection and pleasure together, which can reduce performance pressure and expand the definition of intimacy beyond intercourse, creating a richer, more satisfying sexual relationship. And remember that masturbation is not a substitute, but a complement to partnered sex, a tool to maintain prostate health and emotional balance in all phases of life, including times of separation, illness, or reduced libido. And beyond physical practice, pay attention to your overall lifestyle, because factors like regular cardiovascular exercise, a nutrient-rich diet emphasizing fruits, vegetables, healthy fats, and lean proteins, stress management through meditation or breathing techniques, and adequate restorative sleep create the fertile ground in which prostate health and sexual vitality flourish. And reducing consumption of processed foods, alcohol, and tobacco can further protect your prostate and enhance hormonal function. And as you integrate masturbation into your routine, you may notice benefits ripple through many areas of your life. Better sleep, reduced stress and anxiety, improved mood, stronger relationships, and most importantly, a renewed sense of agency and joy in your body's natural functions. and this shift can be incredibly empowering, reminding you that aging does not mean decline, but a chance to reclaim health, pleasure, and confidence on your own terms. And if you face setbacks or doubts along the way, remember that these are normal and that reaching out for support, whether from medical professionals, therapists, or supportive peers, can provide guidance and encouragement. And lastly, staying informed and proactive about your prostate health with regular checkups, prostate screenings, and honest conversations with your urologist ensures that any concerns are addressed early, enhancing your ability to maintain an active, satisfying life. And by embracing masturbation as a vital part of this holistic approach, you honor your body, nurture your spirit, and invest in your future well-being. And so take this knowledge, this encouragement, and this renewed sense of possibility forward with confidence, knowing that your prostate health and sexual vitality are within your power to protect and enhance, and that by prioritizing regular release and self-care, you're choosing a life of greater health, happiness, and fulfillment at every age. And thank you for joining this important conversation. Your commitment to your health is inspiring, and we look forward to supporting you with more valuable advice and empowering content in the future.